From the front pages of your newspaper to the in front of your television screen, we bring you the captivating stories, those trending stories that made the headlines during the course of the week, separating, obviously, the noise from the facts. This is The Headliner. My name is Monica Chanda.
And my name is Kurtley Gwindi. Yes, we give you the information that is relevant to the week on your weekly dose of The Headline, and at the same time we make sure that we chase and track the most accurate information possible. And of course, yes, this week we are delving into a startling as well as concerning story that has recently emerged from the Parirenyatwa hospital in Zimbabwe. Today we give you a spotlight on the exposure of bogus doctors that have taken the media by storm, and at the same time they have been operating within the hospital. The story that has sent shockwaves throughout the nation's healthcare system, the story that has not only raised questions about the integrity of the medical profession at large, but also cast a shadow of doubt on the safety as well as well-being of patients at large once again. And in our hospitals, join us as we unravel the details, analyze the implications, and explore the broader ramifications of this alarming incident. We are going to make sure that we break this down today on The Headliner. Very, very concerning, Monica, I must say.
Talk about bogus doctors, which also threaten our health system, but definitely we will be looking at that story. But let's take a look at those headlines, and we kickstart the show, or should I say the headliner, with the Newsday, and it does read UZ bosses in allowance storm. So lecturers and other staff members of the University of Zimbabwe up in arms with their bosses who allegedly awarded themselves hefty allowances which were not extended to everyone at the institution. Talk about hefty allowances. I do know, of course, there's always that threat that comes with unequal pay.
And most definitely the ramifications of that always spiral back to the lowest paid, who obviously cry out because of unfair treatment. And I guess this is what sparked the debate, or as well as the trouble that's happening at the UZ right now.
But if I am to be a rebel rouser, sometimes your qualifications can separate you from whether you get that
Very topical, I must
that
say.
kind of allowance or not.
Oh yeah. I mean, this is the headliner, so clearly Monica wants to make headlines with her statements and utterances here. But we move on to the Financial Gazette, which is tagged "Timeless Rollout for the Zimbabwe Gold," also known as the ZIG, which is lifting businesses. And there is continuous optimism amongst both business leaders and analysts that this week's notes and coins will spur the new currency's adoption by the markets and help to lift the country's economy. Very, very encouraging news to be reading on a Friday. Quite frankly, we do know that the ZIG, upon introduction, had a lot of speculation. We did have, the structured currency conversation here on The Headliner, if you were tracking some of our past episodes. At the very same time, now we do know that on the market, we are speaking about the distribution of the notes and coins. Have you, Monica, got a chance to experience that physically?
Well, you actually read my mind. Let me check my bag. Or not.
Just 1 second.
I'll probably treat you to dinner, lunch, breakfast.
Yeah, I'm looking forward to it.
And I'll pay.
We are
it's
going
on me.
in ZIG.
In ZIG.
I'm looking forward to that.
Let's also go to the Daily News tagged "Continue nailing money changers." Both consumers and business urge authorities. So this comes after law enforcement agents said they are winning the fight against illegal money changers across the country, with the dealers having since deserted usual operating areas in major areas. So the law is definitely on top of this and ensuring that whoever is in those illegal operations is brought to book.
Oh yeah, and the law should stand on such these people are really kind of destabilizing the economy at large, and at the same time we need to have an appreciation of what is going on with regards to everything that the structured currency as well as compared to the US dollar. And we move on to this particular story, Monica, that has obviously brought a lot of attention. And we are talking about the story of the day, which is the Herald, which tagged Pari exposes 11 fake doctors, a story that breaks shockwaves across the nation. Let's hear more in the second segment with regards to that. We already broke it down a little bit, and it has been a developing story in the sense that initially it was two bogus doctors that were caught in the act, and at the same time they were also stealing from patients. And then an appreciation that as it developed over the week, in fact in just the space of a week, 44 more doctors were called out with regards to operating within one of, I think, arguably the biggest hospitals in Zimbabwe.
Which also happens to be highly noted in terms of training some of the highly qualified
doctors
who
that
are
we have, actually moving
medical
around.
staff.
Absolutely, absolutely. And some of them actually within the private sector now, upon being trained at Parirenyatwa. So quite fascinating, and at the same time you do want to look forward to this conversation as we will be trekking it, and at the same time we will just be also giving an appreciation. I think before we go, Monica, we had that headline that we particularly saw.
Trust you to bring the social side.
And a little bit of that comes through on the headliner. And obviously, as we take cognizance of some of the stories, it was still within the Herald. And I think, Monica, as you get to read that out,
girlfriend ordered to pay $8,000 in damages. Talk about adulterous
tagged in the Herald. Yes.
It was the H Metro.
Yeah, it was H Metro initially, and I think it then did its distribution. You definitely would, we would appreciate your viewpoint on that within the comment section, as well as, spiraling down to if you were a girlfriend to a married man. And now you are in a position where you have to pay $8,000. But initially, the wife wanted more with regards to the damages and experiences that she went through.
Do you want us to be controversial?
Yes. As a girlfriend, would you pay?
The controversy that is going around is that, sadly, you might find that the same adulterous husband will be the same man who will pay
the 8,000.
The 8,000.
Let's get over with the story, I guess.
But back to serious business. It also is World Press Freedom Day. We'll also be touching on that in the next segment. But the big story, bogus doctors, and it is what we will be looking at on the headliner. So make sure you grab yourself a cup of coffee, cup of tea, water, or just grab something.
Yeah, we'll be right back. This is the headliner.
Welcome back to the headliner. If you've never had an opportunity to watch this program, we get to headline those trending stories of the week from the different dailies, the different publications, the news that trended, whether we're talking print, online, electronic, but that news that made the headlines, and be part of the conversations. We do have a YouTube page. We also stream on Facebook, so please feel free to engage us on those platforms. But of course, the story of the day today in our second segment, we are tapping into the bogus doctors story, and it is this currently where it is believed it's concerning. It emerged from Parirenyatwa Hospital, and the exposure of those bogus doctors that have been operating within the hospital. So there is a lot of doubts around safety, security issues. What does this mean if we're having bogus doctors penetrating these facilities that are supposed to give service, medical service, and some of the most crucial conditions? This poses a threat.
It poses a massive threat, and we are speaking on the backlog of, a number of individuals. You know, we're talking massive figures, and you know, one is way too much. But if we're now talking 33 bogus doctors as well as tutors being arrested at the Parirenyatwa group of hospitals, as we have mentioned earlier, we are speaking about a reputable as well as massive hospital that caters for the health needs of the everyday Zimbabwean across the border. And at the same time, it has been learnt that the referral hospital also indicated that the recently arrested fake doctors do not manage any patient. And this is a developing story, but at the same time, we are also on the backdrop, Monica, of an individual. Once again, this is on the 22nd of October 2020. You know, this was a young man without any medical qualification to his name. He worked in the casualty unit of Parirenyatwa for 7 months. So we're speaking on the backdrop
7 months?
Yeah, 4 years ago.
7 months. this supposed bogus medical practitioner is in and out of the building.
Yeah, for 7 months. He was working in casualty. This was recorded in 2020 on the 22nd of October.
It speaks to the security. How did the security detail miss that? Because I would have to believe that we should be having some sort of system. You know how it is with our institution.
Oh yeah.
There's security checks.
Oh yeah.
No one enters the corporation right from the checkpoint without that security check. It's your identification to the T. And even when you get to walk into the building, we do have we do have a checkpoint again, and we have these machines, these detectors. Why is it we don't have that kind of operation at one of the biggest medical facilities? I would assume that they have some sort of
due diligence,
security detectors,
or quite frankly,
check even your identity cards, because one can actually create a sort of fake identity cards, but those cards could probably have serial numbers or some sort of barcode that allows them access into the hospital,
into the building. Yeah, quite interestingly enough, Monica, as you've raised, this fake doctor who obviously spiraled the entire conversation and obviously leading to the 33 others being caught. He was a young man who goes by the name of Blessing Nyanzira, just 24 years old, and he just appeared before the Rari Magistrate Court, being released on a $100 bail. However, how he was caught was at the security checkpoint. Listen to this, get this. After producing 2 differently identity cards that were different from the name as well that was inscribed on his coat. So these are 2 identity cards, and at the same time, different, and then the name on the coat also different. So he's moving with 3 identities. And
but then 3 identities. Security may have caught on. It's a little too late, because what would have happened the whole time he was within this institution? And in as much as it is reported they've never had to attend to any patients, but then you noted 33 bogus doctors, I think, to date, and this could probably be counting. What would happen if we are not going to make sure that we put more security in check, more operations, more systems in place to ensure that we don't let the next bogus doctor decide to try their luck? Because remember, even on social media, we understand that some of these bogus doctors get certain medications and they go and operate illegally. And some of these illegal operations, for the sake of the public, these are allegations. So it's alleged that some of these bogus doctors are also dealing in some of those illegal drugs, and some of those drugs for abortion.
There's a reason for infiltrating the system. Quite surely there should be some intent behind whatever the young man was working on at the time. If it's not working on patients, he's working on something, surely.
Criminal behavior. That's what it is, because I always believe there's always a criminal mind behind it. We can never justify a criminal mind. Whatever the case, or whether one says, my dream was to become a doctor, and unfortunately my background could not afford me the opportunity to actually go to medical school, yada yada. It's still criminal. And criminals need to be dealt with. So that fine of $100, I think we need to make sure that even our judicial system comes into play when it comes to bogus doctors, because our health system could be crippled or compromised, which is a better word to put it.
Oh yes,
compromised because of the number of bogus doctors. But it's not just Zimbabwe. This also brings me to the attention right across the Limpopo in South Africa. Remember, there was one very famous bogus doctor, social media doctor. He became a sort of influencer.
Oh yeah, at some point he actually carried that title.
He actually carried the title, and he would be in and out. And he started, a lot of prescriptions and diagnosis, even on social media. A lot of people believed him.
A popular doctor.
He became so popular, and it is very dangerous.
Very.
And the same could be with some of these bogus doctors to think, how many have they influenced in their society, in their communities, to actually believe that they're practicing doctors and actually sought medical attention from these bogus doctors and probably compromise their own health at the same time.
At the very same time, yeah. And I mean, coming back down to Zimbabwe from South Africa once again, this was Watmo Taru Garira. 43 years old, and he was arrested last week at the same hospital after exposing himself by reading a patient's x-ray while holding it upside down. Now, quite frankly, as the everyday Zimbabweans, as patients, there's not much we can tell a doctor to do or also scrutinize a doctor with regards to the work, but always it is within your right to ask for the qualification or even a doctor's card. One thing I do know is that the stethoscope.
Stethoscope, Curtly, say it again.
Stethoscope.
Yes.
Together with the gowns, obviously the coats that they wear, it's never enough with regards to identifying a doctor. I can easily go and purchase myself one. Monica.
For all I know, I could be a lab assistant.
Monica can come through, holding the injection, the plastic, the rubber gloves, and, pull off the entire show with the scrubs and everything. But it's always right to make sure. And we are also speaking once again of a fortnight ago when another fake gynecologist who goes by the name of Felix Tagonera, he was arrested at Parirenyatwa.
Gynecologist.
He wanted to get a
disturbed.
show. He wanted to get a show, didn't he?
No, I'm very disturbed. But on the serious side of things, I think this is a call to the public to be very aware of the nature of a lot of criminal elements that we have in our midst. And never be afraid to ask the qualification, or never be afraid to ask for identification of that particular doctor.
It is within your rights.
Yes, never be afraid to also do background checks, even when it comes to private doctors. Some of these are delisted, just like in the legal fraternity where you delist lawyers and so forth. The same can be said for doctors. There are some doctors who are delisted. So make sure that you are safe. Make sure that your health is not compromised at the same time. And legal recourse. If you feel you have been violated whatsoever,
quite frankly, yeah,
please seek legal justice for that. Report any bogus doctors, report any unbecoming behavior from any medical staff, because in as much as we speak of bogus doctors, we also have doctors who are believed to be operating outside the confines of their medical discipline and performing certain medical if I say experiments, for lack of a better word.
Oh, yeah.
So please, let's make sure that we are safe. And as we also get to wrap things up, I think we would not do justice without talking about World Press Freedom Day.
An important day
which
for
is
us,
very
yes.
important.
Absolutely. The theme being carried this year in 2024 is journalism in the face of environmental crisis. Now, obviously, coming back down even to grassroots level here in Zimbabwe, we have experienced the El Nino. We have experienced a massive drought that has affected the country as well, as well as the region and the world at large. And at the very same time, we can't go without saying that journalism has played a very pivotal role with regards to the dispensing of the information around this effect as well as crisis. And the day itself today, being the 3rd of May, represents a day in which we protect and obviously prevent crimes that are committed against journalists in light of the work, the solid work that is done by the members of the Fourth Estate. And we also ensure the rights to freedom of expression, freedom of scientific research, and access to key sources of information, in addition to combating dis- and misinformation through journalism. It carries a very, very huge impediment with regards to everything that is being played with, even within tying in the theme, Monica. And perhaps you share with us what World Press Freedom Day means to you.
Well, World Press Freedom Day means I could probably have a whole 30 minutes
we don't have that much
around
time.
it.
Our
But,
producers are waiting.
for me, I have to say World Press Freedom Day for me means the freedom of expression, the freedom to express myself as a female journalist in a profession which predominantly had been male dominated, especially in the newsroom, where now there is our freedom as a female journalist to also explore the different conversations which also were more male dominated. I'm able to bring those conversations on politics, on business, and show that there is a place for not only men but women in the newsroom on different platforms. But also, World Press Freedom Day for me means let's respect the profession. While we are in the world of digital and we've seen the rise of citizen journalism, it is about time that the greater public got to respect the profession, journalism. It's not just every Jane, Monica, Kirtley that believes once they just get a pen or paper or they just get a podcast, or I'm not criticizing podcasts whatsoever.
Absolutely.
But there is a certain ethics, there's certain rules of engagement when it comes to journalism. And there's a lot of training that goes into our profession.
Correct.
And hence it then undermines the profession itself because of certain behavior that is put out by certain persons.
Utterances.
So with citizen journalism and with social media, people are being given that freedom to go out there and pose as journalists. And when things go south, we're all put in one basket as journalists.
Or as press. Quite fascinating. You've opened up a can of worms. Most definitely, Monica, quite interesting a perspective.
But I'm going to start a podcast. Just say.
I want to be a co-host. Most definitely, this has been the 3rd of May, World Press Freedom Day. If you see a journalist, please buy them flowers. If you don't want, please just buy them lunch. They could use it.
But wait, Kirtley.
Yeah?
Do our producers just want to put out something to them? What does World Press Freedom Day mean to you? I'm sure they're actually watching and they're saying, what are these two getting up to?
We'll get to hear from them, most definitely. But please, if you are also a member of the Fourth Estate and you get to be watching this and you are within the comment section and obviously participating in the conversation on a weekly basis here on The Headliner, where you catch us on YouTube, that is a ZBC News Online. Please drop a comment, follow, like, and obviously share and subscribe. We always want to hear from you. But from me, Kirtley Gwindi.
And me, Monica Chanda, it has been pleasant viewing on The Headliner. And whatever you do, keep it logged on to ZBC TV for the headliner.